So, we are going to see about the bones forming the knee joint. This is of right side femur, right side tibia and right fibula. The bones which will be participating in the knee joint formation are femur, tibia, and over anteriorly we will have the patella. In the lower end of the femur, we have condyles, which are enlarged portions. So we have the lateral condyle and the medial condyle. Over the tibia in the upper end, we have two condyles again, which will be corresponding to the condyles of the femur. So this will be the lateral condyle of tibia. This is the medial condyle of tibia. Coming to the articular surface of the femur over the lower end. So we have the articular surface in the lower end of the femur over the lateral condyle and the medial condyle, and in between the two condyles of the tibia we have the articular surface for the patella, so it will be called as patellar articular surface. The remaining articular surface of the femur will be called as the tibial articular surface, which will be going to articulate with the corresponding articular surface of the tibial condyles. Now we are going to look above the superior aspect of the condylar surface of the tibia. So if we see, this is the medial condyle of the tibia, this is the lateral condyle of the tibia. The medial condyle of the tibia superior surface, articular surface is oval in shape, whereas the articular surface on the lateral condyle, it is circular in shape. In between the two articular surface, we have the intercondylar area. This intercondylar area is narrow in the middle, whereas it is widened in the anterior and the posterior aspect. In the intercondylar area, from anterior to posterior, 6 structures will be attached, which is going to help in maintaining the stability of the knee joint. So we will be seeing about the 6 structures which are attached to the intercondylar area in the specimen. So now this is the disarticulated lower limb at the level of knee joint. To visualize the menisci, so this is the medial aspect and this is the lateral aspect. So over the superior aspect of the corresponding condyles of the tibia, we have the attachment of the menisci. This is medial meniscus and this is the lateral meniscus. When we look into the shape of the menisci on both sides, on the medial side, the medial meniscus is actually semilunar in shape, whereas the lateral meniscus is almost circular in shape, making 4/5 of the circle. So this is the anterior horn of the medial meniscus. This is the posterior horn of the medial meniscus. This is the anterior horn of the lateral meniscus and the posterior horn. So now we are going to look at the attachment of the cruciate ligaments. So we have two cruciate ligaments at the knee joint, which will be stabilizing the tibia to avoid hyperextension and hyperflexion. So the two cruciate ligaments are in the anterior aspect, it is anterior cruciate ligament, and the posterior cruciate ligament at the posterior aspect. So this is the anterior view of the knee joint. So this is the corresponding meniscus that we have already seen, and this is the anterior cruciate ligament. So the anterior attachment of the anterior cruciate ligament will be between the anterior horn of the lateral and the medial meniscus. So it extends upwards, backwards, and laterally it gets attached to the posterior superior aspect of the medial surface of the lateral condyle of femur. Now we are going to see about the posterior cruciate ligament. So this is the posterior view of the knee joint, whereas this is the posterior cruciate ligament. The anterior and the posterior cruciate ligament are named accordingly according to its attachment on the tibia. So the posterior cruciate ligament over the tibia, it is attached between the two posterior horn of the two menisci, where it extends upwards, forwards, and medially it gets attached to the anteroinferior part of the lateral surface of the medial condyle. Now we are going to see about the collateral ligaments of the knee joint. This is the lateral view of the knee joint, which is showing the lateral collateral ligament or fibular collateral ligament. The upper attachment of the lateral collateral ligament or the fibular collateral ligament is from the lateral epicondyle of the lower end of femur. It extends downwards and it gets attached to the styloid process of fibula. whereas on the medial aspect of the knee joint, it is the medial collateral ligament or the tibial collateral ligament. So the upper attachment of the medial collateral ligament of the knee joint is from the medial epicondyle of lower end of femur. It extends downwards and gets attached to the medial surface of the upper end of the tibia.